Hello and welcome to our video where we cover the good and the not so good of occupational therapy. When choosing occupational therapy as a career, it's easy to find and point out all of the good things that may help strengthen your passion for the profession. However, not many people delve into the challenges that come along with being an OT. Throughout this presentation, we will be highlighting all things good and not so good about being an occupational therapist. In order to talk about being an occupational therapist, we first need to know what occupational therapy is and what it is that occupational therapists do. The American Occupational Therapy Association states that occupational therapy enables people of all ages to participate in daily living. In other words, occupational therapy focuses on remediating or improving clients' skills and the things that they need to do, want to do, and are expected to do in everyday life. You may hear that phrase, need to do, want to do, expected to do, quite often when going through OT school, but it's important for you to know that the things we as occupational therapists help individuals with are most often very meaningful and important in their everyday lives. The AOTA outlines 3 services that are included in occupational therapy. These 3 services are evaluations, intervention plans, and outcome evaluations. Evaluations, or otherwise called occupational profiles, are a way to learn more about your client. These include your client's life experiences and occupations that they've participated in, their medical history, and their interests or occupations that they value. Intervention plans cater to the client's personal needs in order to reach their goals that are set with the therapist. This is also called client-centeredness, which is a huge part of occupational therapy. And finally, outcome evaluations are used in order to see if the client's goals are being met with the current therapy they are receiving. As you can see, and I'm sure you already know, there are many benefits of being an OT. Here are the top ones that I was able to find per the University of St. Augustine. Salary. So the salary for occupational therapists can be described as being on the higher end. It was found that the median annual pay for OTs is $93,180. Now, this isn't to say you will start out making $98,000, but your salary range can grow with experience. The next benefit is that OT is a growing profession and there is most likely always going to be OT positions open. In fact, St. Augustine mentions that there is a projected growth rate of 12% between 2022 and 2032, and with that growth, there is expected to be 9,600 annual job openings for occupational therapists. Next is the flexibility to choose which setting you want to work in. If you like pediatrics and the school setting, you can be a school-based OT. You like older adults and want to help people that are limited to their homes, you can be a home health OT. There are so many options to choose from, and guess what? You don't have to stick to just one. You tried pediatrics for 5 years and just aren't feeling it anymore? You can find another setting to work in. It's definitely nice to have that flexibility, especially for people that may have a hard time committing to one area of practice. Moving on to the benefit of there being an endless option for specialties to pursue. So you've got like aquatic therapy, hand therapy, lymphedema therapy, neurodevelopmental therapy, etc. The list could go on and on. The next benefit of being an OT is being able to use your own creativity. Occupational therapy is not and will never be a cut and dry practice. You have the freedom to alter interventions however you want while also staying client-centered. Building relationships with clients that you work closely with is beneficial to both you as the OT and them as a client. As the OT, you get to know them and their personalities over time, which can help guide your intervention planning. And as the client, they feel comfortable with you and will most likely be willing to participate in therapy. Moving on to job satisfaction. Occupational therapists tend to have higher job satisfaction due to how rewarding the profession is, and there's an appeal to careers that keep you on the go instead of sitting behind a desk all day. And then finally, the last benefit that I have for you today is the possibility of acquiring travel OT contracts. You are not limited to one area and you get to travel. It's a win-win. Every occupation comes with challenges, but here are the ones you might face being an OT. Being an occupational therapist can be emotionally stressful. You are dealing with a variety of diagnoses, some of which can weigh heavily on the heart. There may be times when clients do not comply and they may act out and be difficult behavior-wise. The job is also physically demanding. You will most likely always be moving around as an OT no matter what setting you're in. Some settings, however, can be more physically demanding than others, such as acute care, home health, or pediatric settings. Another challenge is that there may be institutional barriers that prevent desired results. For example, budget and funding may get in the way of providing medical equipment, or you may run into problems with insurance companies, such as them not approving recommended treatments to improve the client's quality of life. Let's talk about work hours. This is one of the major challenges with being an OT. A lot of times, OTs work long hours, especially when in a hospital or clinic setting. There are a lot of times where you may have to finish documentation or come up with treatment plans outside of normal work hours. You may have to look at getting certain equipment for client to try, or maybe you have to check in with your clients ahead of time to confirm if they are coming to therapy, etc. The work doesn't stop once you leave those doors. Learning new techniques and technology can be challenging to some. No one client is the same as another. You will always be learning new things to keep up with your clients as they progress. You will also have to get continuing education credits as an OT in order to stay on top of the new things in the OT world. And finally, arguably the most important and extremely challenging aspect of being an OT, finding balance between personal and professional life. Working those long hours can become overwhelming and throw your balance off, but it's important to maintain an equilibrium in order to be the best OT you can be.
When looking at occupational therapy education, a pro is personal and intellectual growth. OT education leads to an increase in intellectual growth. This is by promoting critical thinking skills, enabling you to analyze different situations, solve problems, and make informed decisions. OT education also leads to personal development, and the education provides you with knowledge and skills that can help you succeed in different aspects of life, such as your career and personal relationships. OT education is great at providing networking opportunities. This includes having many different guest speakers in class. Fieldwork is also a great way to network with practicing OTs. Level 2 fieldworks, which are 2 12-week fieldworks, are a great way to potentially have a job in line after school, as fieldwork sites often offer jobs to their fieldwork students once they have completed schooling. A pro of OT education can be that an OT degree requires either a master's or a doctorate degree, while PT requires a doctorate degree. So Maryville is a master's program, so it's a 2.5-year program, while the PT program is 3.5-year program. So the OT program is shorter than the PT program. A pro of OT education can also be the cost. So typically master programs are less than doctorate programs. So since Maryville's OT program is a master's degree and Maryville's PT program is a doctorate, the OT program is cheaper than the PT program. One of the biggest things to take into account when looking at applying for OT programs is the cost. While I did mention it as a pro when looking at other health-related fields, it can also be a con because it is very expensive. The average total cost of the master's program at Maryville is $70,000. If you go to another school that is a doctorate program, for example, WashU, the average total cost is $149,000. Master's degree are going to range on the lower end of cost, while doctorate programs range on the higher end of the cost. Another thing to take into consideration is time commitment. The master's degree at Maryville takes 2.5 years to complete, and while a doctorate program at WashU, for example, takes 3 years to complete. While in the program, the workload is very heavy and the courses are advanced, so you'll be spending many hours in class as well as studying and completing assignments outside of class. Because of the time commitment, working while in graduate school is very difficult, but it is possible. Lastly, your mental health is something that should be a huge consideration when applying to OT programs. A study by Sinith Kumar found that 50% of graduate students report symptoms of depression, anxiety, or burnout. This is due to the stress that comes along with graduate school, since it is very difficult.
So there are a lot of good pros to the variety of settings you'll see in occupational therapy. There are a variety of clients and age ranges, variety of diagnoses and conditions, and a big variety of locations to work at. So you can really try them out and see which one you prefer. A little bit about them. So pediatrics include hospital settings such as the PICU and NICU. You will see pediatrics in early intervention, which could be outpatient clinics, classrooms, and schools. In the general adult populations, the different floors of hospitals could include intensive care units, surgical units, neuro units, cardiac units, and the list goes on and on. Adults will sometimes, after acute care, go to a rehab hospital or inpatient rehab facility to continue the healing process, or they might need to transfer back to home and be home health care. And adult populations will also have outpatient clinics. One very popular outpatient specialty is hand therapy. Older adults have the same settings as the general adult population, but they are also very popular in skilled nursing facilities and home health care. But they can be in any hospitals or inpatient rehab facility as any other population. Different diagnoses you'll see include mental, emotional, social, and physical conditions or disabilities. So mental health could have a variety of diagnoses and conditions. There are different physical injuries, physical illnesses, or disabilities you may or may not see, and pediatrics especially are common for developmental delays and disabilities, and diagnoses such as autism and ADHD. Some different things to consider with settings are some of the challenges. So hospitals are very fast-paced, so that means you might only see clients for a very short amount of time. You have to be able to think quickly on your feet, and you don't get to complete many interventions. So this might not be the setting for you, especially if you're squeamish with hospitals. They can be kind of very traumatic and intense cases and conditions. In skilled nursing facilities, they have high productivity, which the demands might be very high. You might have to work through lunch, work through breaks, or work overtime. Different Medicare or any insurance requirements especially can be difficult, especially for documentation. You need to know these systems inside and out, and you need to know what you need to document in order to get your client to have their insurance cover treatment. Inpatient rehab facilities can have very long treatment sessions, high needs and complex patients, and trauma. So if this isn't something you're interested, you need to make sure that you need to check out these settings and see if they're right fit for you, whether or not you really want to get into a complex need client. Outpatient clinics, they can be difficult in that they have cancellations a lot of the time. You'll have your day planned and it can change up on you on a dime. It's the end of therapy process typically, so you might see slower progress with patients. You might have challenging patients, such as if you go into the hand therapy specialty. It's a pretty contrived environment, so you're typically only in a gym, so it might not seem as occupation-based as other settings. And then in home health care, there are good things about home health care in that it's within the client's environment and it's very occupation focused and individualized and centered around your clients. However, you do have to drive to their home, so if you're not a fan of long driving hours or long time commitment to that, you need to consider that as a part of where you would want to work in the future. You don't know what your client's setting will look like until you get there with home health. So if at all possible, try to shadow at a variety of settings or look more into the settings that you enjoy or think you might hate to see if OT is right for you.
Research has shown that most occupational therapists tend to share higher job satisfaction than that of nurses, but lower job satisfaction than that of physical therapists and physicians, respectively. In this, most OTs tend to be most satisfied with the salaries that they're being paid for their work, the meaning that the career has to their life and purpose, the self-fulfillment that the job provides based on their work environment, as well as their use of clinical skills and being able to apply their education to their work environment and day-to-day setting. Job satisfaction is a subjective measure and can vary across settings and between individual practitioners.
Predictors for higher job satisfaction include years of experience, the perceived influence of the individual on the unit's goals, as well as the feelings of value that the individual shares between their managers as an individual, as a practitioner, and as a person within the unit and their job experience. Ultimately, the career you choose is up to you and very dependent upon your values, interests, and goals for where you want to be and what you want to do with your life. Tips for choosing a career, especially related to occupational therapy or another health profession, include participating in leadership roles within your program, participating in lots of shadowing experiences, and identifying an OT as a mentor that you can use to ask questions, bounce ideas off of, and gain insight from for use in your future experiences. You can volunteer in settings with roles related to OT to gain further experience and insight into what OT looks like in various practice settings. And finally, do your own research on schools and OT careers to make more informed decisions to better guide your progress and your experience throughout graduate school and beyond.
Thank you so much for listening to this presentation. We hope it helped you to see some of the considerations, pros, and challenges that come along with being an occupational therapist, and we hope the tips that we provided help you to discover if this career path is right for you. You can access our references and resources we used using this QR code here.